Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson.
And I'm Jenny Johnson, IBCLC.
Woohoo! So guess what? It's World Breastfeeding Week.
Awesome!
I know last year we talked about it, and breastfeeding means chest feeding.
Feeding human
All
milk.
the feeding.
Whatever.
Human milk feeding.
Human milk feeding.
So we want to do a series, so this will be a three-part series, talking about breastfeeding. And so we're going to start out with most commonly asked questions for breastfeeding.
Yes. And I think that one would be, is my baby getting enough? Coming from a culture of bottle feeding and knowing how much is going in, it's difficult to trust our bodies and know that our babies are getting what they need.
Absolutely. So if a mom is worried, is she getting enough? I know it is supply and demand. As the baby demands, supply comes in. So the more you can nurse, the better. You do feel like you are attached to this baby at first, which is
Absolutely.
normal. But we want to get from that colostrum to the transitional milk to that mature milk and have your milk come in. So the baby is going to be feeding a lot more. Some people even call it cluster feeding, and that can be kind of taxing on the brain. So what are some ways people know my baby's getting enough?
Well, first and foremost is how deeply the baby is latched. Baby really should be latched about 1 inch back from the base of the nipple. We used to tell moms that areola needs to be in the mouth. Well, if you have a saucer size areola, there's no way you're gonna get it all in there, but we want baby deep enough that they're draining the breast at a kind of relaxed, comfortable pace. If they're latched too shallow, they fatigue, and then they stop feeding early, fall asleep at breast, and they're not getting what they need.
So it's not nipple feeding.
Correct.
Breastfeeding.
Breastfeeding.
Okay.
Absolutely.
All right. Another question is, when do I start pumping?
So pumping is an interesting topic. So my big question first is, why do you want to start pumping? So are we engorged? So breast is really full, baby's not draining well? Well, then I go back to latching. Are we latching well? Are we draining the breast properly with baby latched well? And then if we're looking at storage, we really want to kind of hold off till about a month or so, because we really want baby to set that supply and demand versus the pump setting your supply and demand. Some moms will go into perpetual engorgement because they're removing too much milk.
And what about using the haka?
A haka is fabulous for collecting small amounts of milk to be able to start putting some away.
Okay.
I would use it cautiously. We don't want the body to think that the haka is another baby.
Okay.
But we could definitely use that to kind of give ourselves some relief and start a small stash.
Okay, perfect. And do we have any other questions that we wanted to go through? And that would be something too for you guys. If you have any other questions about, the basics of breastfeeding, let us know. We will respond to you.
Yes.
And so Jenny and I were talking, we could be here for days with all of these. So tune in next week and we're going to talk about some other things. So we will see you soon. Bye.
Happy World Breastfeeding Week.